Hi, everyone. Welcome to our latest APMA PodMed student webinar, How to Prepare for Residency Interviews. My name is Tiffany Kildale, and I am the Career Development Manager for APMA. We are excited to offer you all this webinar today. We want to help you prepare for upcoming residency interviews, which are next month, and understandably will be a little different this year than they have previously, as with everything else. So we have lined up a couple podiatry residents to help answer your questions this evening and share a little bit about what they experienced during the residency interview process, along with their insider advice that they may have for you all regarding what programs are looking for and really how to present your best self during the interview. So if you all have listened to these before, you know we rely heavily on Q&A. So as always, we will feature a lot of question and answer throughout the broadcast. Please feel free, submit your questions as we discuss. You're able to submit your questions through the webinar, throughout the webinar, by submitting your questions through the question box at the bottom of the GoToWebinar toolbar. So with that being said, joining me today, we have Drs. Morgan Baxter and Sindhu Srinivas. Dr. Baxter graduated from Kent State University College of Podiatric Medicine in 2018. She is currently a third-year resident at the Heritage Valley Beaver Podiatric Residency in Pennsylvania. And Dr. Srinivas graduated from Barry University School of Podiatric Medicine in 2020. She is currently a first-year resident at the Geisinger Community Medical Center in Scranton, Pennsylvania. So welcome to both of you. Thank you all so much for taking the time to join us this evening. So we're going to jump right in, and I'm going to start. Our first question, I'll start with Dr. Baxter on this one. Dr. Srinivas, you can chime in. All right, what did you guys do to prepare for residency interviews?
Man, that is such a hard question, I think. Everyone prepares differently, honestly. For me personally, it was getting with a couple of my friends and just, going over some high yield, case study type of situational scenarios. So I think that's good to do. I think you need to find like a core group of people just to try to like bounce ideas off of, make even up PowerPoints about just, a couple trauma cases, a couple like diabetic foot cases, things that you're going to be asked about, and just make sure you know the bases, of that stuff. Obviously, especially this year, I'm sure a lot of you had programs cancel just because of the COVID pandemic. So a lot of people don't know each other, and it's going to be interesting this year to kind of see how that all plays out. So this really is, your first time really to make an impression on a lot of the programs out there.
I agree with a lot of what you said, and I think like one of the main things is as you like went through your fourth year, you actually were preparing for interviews without even knowing it. I know a lot of the programs like I externed at actually did mock interviews, and my school offered that as well. And so I would say, kind of like to tag on with you, like I would make case studies and kind of we would rotate within our group who would present. So we would pick topics like maybe fractures you might see, or like diabetic foot infections, gas, like things you're going to expect or you've seen throughout your externships. And I think we would rotate doing those to practice. And I also highly recommend, like while you're studying for it, like for your boards, you're actually studying for interviews as well. So I would study for boards in the morning by doing boards vitals, and then in the afternoon I would read the same concept and maybe put it into like a case study version. So it's not like you're just studying for one thing. You're actually more prepared than you think. But I would say just change the format on how you essentially study. And I think one good way, like you mentioned, is forming a group and kind of taking turns presenting and guessing on different case presentations.
I can't, what's the word I'm looking for? Stress enough that you knowing something on paper to you presenting it out loud is so different. So, it's something that like black and white, it just might be hard to formulate what you want to say. So it's very important to try to practice, talking out loud. I know it sounds stupid, but it really is a big thing because, like I said, it's easy to know something or something in that lines where, you can like sit down, write it out. But when you're in an interview, you're talking one-on-one or on camera with people. So it's a lot different.
And I completely agree. I think one of the things I personally struggled with is like even reading an x-ray. Like when you are looking at it on paper, you could be like, oh, this is an ankle fracture. But actually going through it, like getting the right verbiage is so important. A lot of the tips for interviews is just to practice. You have to keep repeating it to yourself, repeating or kind of expecting what they're going to say next. And I think you're very right. Like you can know all the material, but if you don't practice saying it out loud, when you get it, you might just be like, oh, I don't know how to put it into words. And I think that's where your practice comes into play.
You guys have made a bunch of really, really good points. And Dr. Srinivas, I think you touched on something that's really important. One being, right, you know more than you think you know. And I like this concept of sort of dual preparing, right? Like you mentioned studying for boards in the morning and then maybe sort of repackaging that and applying that to your residency interview prep as well. So we did receive a question from the audience. How did you guys prepare for boards and how did you sort of make that overlap work a little bit?
Well, for me, I guess like I would spend the morning, like I mentioned, I would do board vitals. And then we have like the foot and ankle like book, the Pocket Pod. And if you actually buy it, you have an online version to it. So I would go through the questions I missed on boards vitals and just like kind of control find those words or like those concepts in my Pocket Pod and read that section. And then at the same time, I would kind of make like my own study guide, just like highlighting the topics maybe I missed a lot. And at the same time, I would see a lot of similar trends like antibiotics and things like that. And then I would kind of cross-reference that and I would be like, okay, if I get an open fracture, what type of antibiotics would I recommend? And so you kind of just take one concept, like everything they ask is something you're already know or you've been exposed to, and it's just trying to think of different ways they're going to present it to you. And I think, like Morgan mentioned and Dr. Baxter mentioned, is just that like you have to practice, like you have to expect what they're going to ask. And a lot of times they're not trying to like blindside you. It's very much on topic. You just have to be prepared by kind of going over the general overview of, okay, these are the antibiotics. What do they typically like ask in regards to different cases? Or if I have like someone who's coming in with an infection and they have this allergy, what's something else I can recommend? So it's kind of just like trying to think like that. And I think that's where like talking it out with someone really comes into play, because sometimes you might miss something that someone else is able to catch and be like, maybe this is a concept you can go over. So I think that it's very crucial you spend time by yourself to study, but then also review those same concepts with someone else, so you guys can kind of build your own like plethora of database for like questions you might expect and see.
I couldn't agree more. I think that's very true. Just to go off with what you said, again, when you study, everything is kind of compartmentalized, or at least that's how it was with me. I was like, all right, this is all pharmacy and this is all biomechanics. So it's really when, when you're talking out loud, that's when if you really understand something, or like a case or a concept where all those different pieces kind of play into working up that patient or caring for that patient. So, and that's how real life medicine is really, it's not just very compartmentalized. You have to take into consideration multiple factors about a patient, to really treat them well. So that's what really, I think, when we do cases with people in our, I know in a lot of people's, interviews, that's what they're looking for, is to see if you get the whole concept, not just kind of things here and there. But obviously you're not going to know everything. No one ever knows everything. I still learn things every day. So we're not looking to see, if you know every single question we ever ask you. A lot of times it's more so, how are you thinking through your cases, or what's your mind process through it. So it's never wrong to, kind of talk out loud when you're doing these interviews, because like I said, even if you're totally wrong, if we see that you're thinking the right way, then that's promising for a resident.
And I completely agree. Like sometimes like you might get asked something and I know people are like, just say I don't know, but just explain why you might be on a certain train of thought. Like if they ask you something and you're not completely sure, at least explain your processing so they know that you're thinking out loud instead of just saying I don't know. So I think that's one of the things, like when you're going through externships, people say, if you don't know, just say you don't know so you can learn on it. But when it comes to interview time, I think I would highly recommend, like, I didn't know some answers during some of my interviews, but I kind of walked through my thought process of like, oh, this is what I was thinking. And they're like, oh, you're on the right track, just keep going. So I think it's important, like, I think that helps with talking out loud. Like, if you haven't practiced talking out loud, when you get there, you might be like kind of taken back if they ask you to talk it out with them. So I think that's very important.
Really great insight and great tips. Thank you for that. So shifting gears a little bit, first of all, a lot of students have chimed in to thank you both for participating this evening. So your insight is noted and appreciated.
Nope.
When an X-ray is presented, should we do a full read or focal reads based on the HPI/clinical scenario?
I know in our interviews, we usually say, you know, like, can you please like talk about the pertinent things that you see there. But if no one gives you any direction, you know, I would start saying, these are weight-bearing X-rays of the foot or the ankle. You know, this is the AP view, medial oblique, whatever. And then at some point they'll probably say, all right, can you just tell me what exactly, like, you know, what pathology you see? It's just, I mean, interviews are like 20 minutes long, so we don't have time to hear everyone go over like an X-ray foot head to toe, but definitely have a system down, I would say, with your X-rays, just in case people do want to hear you say things out loud, because I can't speak for every program out there, but some people might want you to, you know, really see how you systematically go through an X-ray to make sure you're not missing anything. So, you know, either start soft tissue and then move into bone, or, you know, even if you start with that pathology, you know, at the end, maybe comment, say, you know, the soft tissue looks a little swollen, or, you know, there's no fractures, there's no dislocation, stuff like that. So that's what I know. I think a bunch of programs are looking for, but again, if no one says anything, then I would just start reading, you know, systematically something, you know, either starting, like I said, soft tissue or start bone, and then just read like you would any other X-ray.
I completely agree. I think this is like one of the things I struggled with the most when I was a student, is because I would try to do a full read and I wouldn't start in one area or another. So I would highly recommend first is kind of systemically, like, I think every program pretty much, like you mentioned, like you only have 20 minutes. They know what you're getting to. They kind of give you in the HPI, like, this patient had fallen. So you're kind of expecting like a fracture read or anything. And I would say start off read with a full read, but more than likely most programs pretty much tell you, give us a focused read. And for me personally, this is where I think like the talking out loud and practicing on my own also came into play. And I actually like used to Google Radiopedia. It's a website. You can just Google that and then put like ankle fractures or like foot fractures, metatarsal fractures, and they give you like examples on your right hand side. So what I would do is I would pull that up and I would read it to myself, and then I would kind of type out like, this is how I would read it. Then as like I was a little more familiar with my own script per se, I would ask someone like my upperclassmen or some of the residents at different programs if I could practice with them, and I would actually read that out without a script, and I would have them correct me, because sometimes if you don't go in one particular manner or another and you get like a little nervous, you might be all over the place. So it's hard for people to follow what you're looking at. So this is where I think like it's the biggest amount of practice that can come in. And same with like CTs. A lot of programs might ask you, is this a sagittal cut? Is it an axial? And if you're not familiar with it, I would say like use websites like Radiopedia. They have CTs, they have MRIs, and you can look up like ankle fractures, foot fractures, or infections, gas, and then kind of practice reading it, and then have someone critique you while you read it to them. And I know there's plenty of people who are willing to just listen to you, because it takes less than like 5 to 10 minutes for you to read it. So practice, practice, practice. That's like my biggest like key point for X-rays, because that's where I personally struggled. And I think like closer to December is when I sat down and I did repeated amount of readings that kind of helped me know going into interviews that if you gave me any type of things to expect, I can at least read it proficiently enough to give you a diagnosis if necessary.
Thank you for that. And I just chatted the link out to everyone listening, and I believe, and hopefully it was the right one, radiopedia.org, correct, Dr. Srinivas?
Yeah, I think there's like two, but if you just Googled even like Radiopedia and then do like foot or ankle x-rays, it's like one of the first things that comes up. And on the right-hand side, there's multiple like images you can practice on.
Perfect. Okay, good. That's super helpful. Thank you for that. So our next question, with interviews being online, do you think interviews will still ask students to suture while asking questions, or other ways to simulate testing hand skills / multitasking?
That's a good question, honestly. I feel like that's kind of unfair if you're at home because who knows, like, unless a program tells you to have that before your interview, then how are you going to know to, have that? But I can't put anything past any residency, so I don't know. I honestly don't have an answer for that.
I agree. Like, I think like the program I'm at now, like one of our social part is like we hand tied while the director just asked us like just social questions about ourselves. But I think it's kind of hard to like have everyone grab supplies and be ready during a pandemic to go. So I highly doubt that's going to be like a big portion of it. I think like with virtual interviews, it's us getting to know you as much as you getting to know us. And I know a lot of people like externships or months have been canceled and you haven't had a chance to go, and like we're understanding, like we know it's a difficult situation, like we've had students not come here as much as like we want them to, so I think it's an opportunity for both of us to kind of get to know each other. So I don't think we'll be asking you to suture or hand tie, things like that. I think it's more like there will be cases and things like that, but I think it's more like getting to know you because it is the first time many of us are meeting. So I think the circumstances are a little different this year around.
I agree.
I can't believe you guys don't just have suture kits laying around at home. Like, I'm so disappointed.
I pull it out.
That's awesome. These are all great questions. Guys, keep them coming. You're welcome to submit them through the question box on the GoToWebinar toolbar. So this is something we sort of, Dr. Baxter and I were talking before we got online here, and one of the things we remarked, and something to keep in mind, this year is going to be so different for everybody, right? On both sides of the interview. So, I mean, this is residency programs going through it in this fashion for the first time, as well as the students participating in the interview. So, what are programs looking for during interviews just in general, right? Dr. Srinivas, you touched on it a little bit about just trying to understand who you are as a person. Is there anything you guys can elaborate on for that?
I agree. I mean, I think, and it's hard, it's 20 minutes, you're meeting someone for the first time. You can't really assess their body language on camera as much as, in person. You can't, like get a feel for the room. It's going to be challenging for both the residency program as well as the students. But my biggest thing, and this is how I've always felt, is just be yourself, don't try to be someone you're not, just, I think that's personality kind of comes through no matter what platform you're on. So, it's really easy to, everyone's obviously going to be nervous. And that's very normal. That's normal for if you're down in Texas too, but, just be yourself and just try to show us, who you are in those 20 minutes. And I don't know, there might be people having socials as in like, I don't know, web parties later on. I honestly don't even know what our program's doing with that, but that would also be a good time, if you really are interested in programs, and unfortunately, they might be like multiple at the same time. But if that is something that you're interested in, that's where you can really show us who you are as well. So
I think one thing that's different for me is like after every externship, I actually wrote a thank you card to every resident or the director or the attending that I worked with. And I think this year, I'm assuming because of you're not getting a chance to interview with every place you wanted to, or like meaning if you have an extern there, I would highly recommend writing down the people on the interview if you can and just sending a thank you email. It's a small gesture, but it kind of shows that like you're interested in the program, and it goes a long way because it's hard to gauge also like through the like be yourself, but it's hard to gauge like if you're interested or not, because I know that everyone's in the same predicament. So I think I would highly suggest kind of writing down and just shooting us an email and just like communicating, hey, I might be interested. And I know for our program, I actually like do virtual tours. So like a lot of students reach out to me, and because we can't physically have students here, I set up a day where I kind of like call them personally and show them a tour of our hospital or our clinic, and even introduce them to some of the residents. And I think like that's something that we would be willing to do if you're really interested and you haven't had a chance to come here. And I think similarly, other programs might have different ways they interact or give you opportunities, so you do get to know them just beyond the interview in those 20 minutes.
Definitely. I know our program was holding like every other Sunday or something, like a virtual happy hour, just to, like gauge people, and, if people are interested, just to kind of answer any questions, and then, kind of get to know the residents a little bit better too. So I'm sure there's a lot of other programs doing something similar.
Yeah, so if you ask anyone or like reach out to the residents, I'm sure a lot of us would be willing to connect you with someone if we're not directly in charge. So, but that sounds fun. I would be happy to join a happy hour.
So, what was your strategy when tackling rapid fire questions? What pace should you have when coming across each question? And Dr. Srinivas, you sort of already addressed this. Did you practice with your classmates and time yourselves with each question?
I personally didn't time myself, but like as I was going through the externships, a lot of my programs that I externed at did have interviews at the end, and they had rapid fire questions. Actually, throughout my externships, anytime I would be asked a question, and if I didn't know, I actually would write it down. So then when I got to December, when I had the month off, I actually had a whole I think I had over 100 questions that I was like, oh, this is something I didn't know. And then I would just like, as I was reading about it, I was like, oh, this makes sense. Like, I remember like I would ask like certain antibiotics that I wasn't familiar with, or something about skin grafts. I would just jot it down. And I think that was kind of my strategy going into it. If you're at this point and you haven't like written anything down and you don't know where to go, I would just say think of like common questions you were asked during your externships, or even things that you might think that come up. Like I talked about it a little on my post that I did. Like I often got asked like antibiotics or different reversal agents, and things like that are common trends that you're always going to see. Or they might even ask you to name like a classification system for certain types of fractures. So kind of just like reviewing things like trends that you see will be super beneficial. But like I said, if you're studying for boards, you're actually studying for those rapid fire questions. I personally always used to get anxious because I didn't know what to expect, but I would look for common trends. And I think like the closure is really good. In certain sections of it, I would just like repeat it or have someone ask me, and that really helped me like prepare when it came to it. But I never personally like timed myself for anything.
Yeah, I agree in that situation. It's called rapid fire just because they're just like, they give you a question and then you give like a one-word answer or something. They're not like legit like as fast as you can do it. So I don't think time yourself really means that much. But like you were saying, very common questions are asked because they're common. So, almost every program, either someone has been asked that before, or it's very common that you're going to see on your board, the reversal agents and antibiotics or stuff you're going to see for the rest of your life on boards. They don't go away. So, those are just very common questions, or things that you should know. Like, I mean, with diabetes and, their medications, and like what kind of antibiotics or what kind of organisms are usually found in that. Like, those are like real life scenarios that you should know. So rapid fire questions. Now, there are programs probably that have like crazy questions that, you're just kind of like, what does that have to do with anything? But 9 times out of 10, there are questions that, you've definitely probably been asked at some point in your life. And it's a little too late now, but I think writing down the questions you don't know, even the questions you do know, having a book at the end of your externship is like invaluable, because those are questions that, you know, that you've been asked, and then you might have seen, you know, in your book a couple times, wow, this is the same thing, just asked differently. And, you know, that's, again, just, it's common. So those are things that you would want to kind of know.
Okay, so what is the best way to say, I don't know, but I can find out?
I think that's perfect. That's the perfect way to say it. So if you truly genuinely don't know something, it's not, that's not like frowned upon to say I don't know. It's just, if you start getting into like this trend where you're saying I don't know from multiple questions, that's when it kind of starts to get like, well, what do they really do? What exactly do they know? So if you don't know, if you absolutely have no clue about anything, you just say, I don't know, I can let you know later. But if you have any kind of clue, or, you know, you're thinking something in a direction in that genre, I would at least kind of throw it out there, because people, especially, I think a lot of programs, you know, if you're on the right track, they're gonna like help you through that case. They're not gonna just sit there like stone faced and not give you any kind of feedback. So I think, you know, just talking through it. But if you say you don't know for like 3-4 questions in a row, it's really hard to gauge, you know, not only the competency, but like what your thought process is.
I completely agree. And that, like, you're not going to know everything, but if you truly do not know, at least be like, this is what I was thinking. And then most programs are actually, they will willingly will walk you through. Like, I remember I had one interview, I visited them once, they asked me a rapid fire question on a classification. I was just like, I'm not positive. And then I just paused, and the director was like, okay, talk me through what you're thinking. And I just said a couple of sentences on the extra, and he was like, yeah, you're on the right track, keep going. So I think it's like very important, like if you truly have an idea but you're just afraid to say, just be like, but this is where I'm coming, or this is the track I was thinking of. But they'll usually help you. Like no one is there to make you feel bad. At least with all the interviews I had, like I felt like every program, if I genuinely did not know or I was hesitant to say, they kind of like were like, don't worry, what are you thinking? So I think that something to ease your mind is like no one's like there to put you down. Like most of the programs are very friendly and they understand, they've been through this. So I think just like be genuine and just be like, I'm not sure, but this is what I'm thinking, or I don't know, I'll get back to you later. But like Dr. Baxter said, you don't want to keep doing that as a trend during rapid fire or anything, because it also puts you in a mindset like, oh, what do I know? And then the interview is not going to go in the right way. So I think that if you really don't know, just be like, do you mind if I talk it out with you or something? And most programs are okay with that, but just be mindful of the time as well and where you're doing it.
Great tips, guys. That's super helpful. Thank you. So do you have any tips on how to go about a program that hasn't offered interviews to us yet? Should we email them or wait for them to offer an interview? How should we proceed?
I'm pretty sure my program has not offered any interview. So if anyone's looking at Heritage Valley, it's coming. I think every program is different. Like we were talking, obviously this is new to everyone. And you know, a lot of times residency directors are very busy with their own, you know, work schedule. So finding time to like get to their coordinator, you know, to kind of set all that stuff up can take a while. And then obviously it's like December and there is Thanksgiving and now Christmas is coming up. So I think you just give it time. I mean, obviously if if you're interested in places and you know someone at that program, it's not a bad idea to like reach out and just say like, hey, I haven't heard back, and just see what their program's doing. Because like I said, my program I don't think has sent anything, so it's just kind of schedule wise. And I think if you really are interested in a program, you know, just reach out to whoever you know there, or even like the contact information, and just say, you know, I am interested. Like, have you guys sent out invites, or, you know, whatever they're called, yet? And that program should, you know, let you know either way.
I agree. I think that there was only one program like during my experience that I didn't get an offer, and I just ended up reaching out to the resident because I did visit the program even though I didn't extern, and I asked them and they were like, oh, we haven't given out interviews yet. So I think that you have to, like, I personally know for our program, I think it's like a rolling basis that they review it certain days just because of everything going on. but I don't know if all the interview invites have gone out completely, like you said, because they have so much stuff going on. So I would be patient, but if it's a program you have externed at or like you have visited and you're highly interested, I'm sure you have relationships there with the residents. I would just ask them, hey, like, did they send out invitations? Like, I'm really was looking forward to accepting, but I would give it time because it's only like the 8th of December. So I know I didn't even get all of mine till midway through December.
So shifting gears a little bit, how specific should we get in describing surgical treatments, such as including incision placement, osteotomy cuts, hardware type or brand, post-op care, etc.?
I know for our program, it's not so like that's stuff that you learn in residency, right? We're in surgical residency, so you learn, the technique of and everything in residency. But at least saying if it's an ankle fracture, like how would you treat it? Closed reduction and then going into the OR to put some plate and screws in. Like I think that's a fine answer. And if they want more, they want more. I know sometimes our program likes to ask about like the small frag set and what are the standard screw sizes and the plate sizes and the mini frag, small frag, large frag sets. But that's just our program, and I don't know if there's other programs like that. There might be. So I mean, obviously, the more you know, the better. But I don't think we would like look down upon you if you didn't know all of those answers. Sometimes I think also like for the residency program, it's easy just to, ask questions like that, just to get a gauge again on how much the student knows. Now, like some of the very common questions, like where do you make your cut for an Evans? Like I think that's a fair game, stuff like that about, or like what bone do you do a cotton osteotomy in? Like all those are, I think, fair game because you learn that in school. But the techniques of like the ins and outs of surgery, I don't think that's something that we're really going to be like focusing in on, honestly.
And I agree. Most of my interviews, like they might be like, okay, like just walk us through like how you might fixate it, but they weren't like giving me specifics of like the plate size, the screw size. But it's always good to know, and you actually have all of that in like your prism book if you have it. Like there's a whole set on the ankle fracture which talks about like your neutralization plates, your buttress plate, and you actually see those questions on boards. So believe it or not, if you're studying for it, you actually know the same concept. So it's just kind of putting that into place, and it tells you essentially like when you might use it. And I think most residency programs just want to gauge that you can like verbalize what you've learned. And I think it's the same, like they might ask you things like, okay, if you have a calcaneal fracture, like what type of incision you might do, but that's something you read about. It's not like they're asking you to walk you through like step by step like dissection or anything. So I think those are like common things like we talked about, even like rapid fire, they might ask you about a plate or a set or a screw, but it's like things that you have read about and you're familiar with. They're not trying to throw something out of left field. And I completely agree. You're going into a surgical residency. There's no way you're going to know everything, and they know that. They're here to teach you. So I think it's more so understanding like common things that you should kind of have a general idea for planning, but no one's going to ask you specifically like walk me through every single step of this surgery, because honestly, within every program, every attending might do it differently. So yeah, so they're definitely not going to penalize you for not knowing every single step of a surgery or a procedure.
What would you all recommend to do if interviews overlap?
Yeah, I didn't think about that. That does happen, sometimes even in like real life interviews when you're going there. I think you need to prioritize where you see what program you are interested in more, honestly. And if you can, maybe if you have two overlapping at the same time, I would keep the appointment that time with the one that you are more interested in, and then reach out to that other program and see if there's another time they can offer you. I don't know how it is this year, but I feel like when I did it, when I was going through interviews, I think there was like multiple like time slots that you can pick. Maybe I'm not really sure if that's how it was. It's been a while since I went through this. So, but if that's the case, I don't think it'd be a bad idea to like reach out to that program and just ask them if they have another time available.
So one thing I do know is like with virtual interviews, you guys as students actually have an advantage, because usually when we go to Texas, you get like 2 days and they're jam packed. Interviews are actually spread out more than a week this like time around. So you actually have more than one time slot or like a particular time. So I would say prioritize which one you'd want to go to, but at the same time, when you're actually setting up your interviews, you get multiple time slots. So I actually wrote down like which ones were my top choices kind of, and then prioritize that and schedule that first. And then the other ones I like scheduled kind of like in between or after to kind of ease myself into it. So that's something you consider, but I definitely think that you have many more options this time around, and it's to your advantage, because I personally know our program has an interview for a whole week. And in Texas, they typically only have 1 day in previous years when you're there in Texas. So it kind of plays to your advantage to kind of fill out wherever you need to, because you have more opportunities to interview.
I would just look into that though too, because I'm pretty sure our program's only doing 2 days worth of interviews. So I think again, like every program is different. And then just like 2020, you know, nothing's set in stone. So I know we're just doing 2 days just because of, again, time constraints with everyone else's schedule. It's really hard to take off multiple days or whatever, and a lot of our attendings are very busy. So we're doing only 2 days. But again, we can make accommodations. I think if you're really interested and there's really not, like there's a legitimate reason why you can't interview on whatever days they are offered. But again, that's why I said, you know, if it's a number one priority, or if your program is in the top, then you really have to kind of make accommodations to accommodate them. So
is it common for programs to do callbacks or follow-up interviews? And what has your experience been with them? And I understand this year, you know, it'll be different, but thoughts on that?
I honestly have no idea how they're doing it. Sorry, go ahead.
Go ahead.
I was like, I have no idea. Like, they typically, for our program, we have a social, and some of the other programs that I was in Texas when we interviewed, they had callbacks like the night off that someone would reach out. But I have honestly no idea how we're doing it this year, or even if we are doing it, just because like if we have interviews for the span of the week and different residents are rotating through to conduct the interviews, I don't really know if we're setting aside extra time to have like a social or anything. So once again, I don't know. It could be different programs have like different concepts of like what they're planning to do. But I just, from my experience, you used to when you're in person, but even then, not all programs did. So it kind of varied.
I agree completely. I think it's a program by program kind of decision on that. So it just really depends on what each program's doing. Because we also used to have a social for 1 day and then 2 days of, it's not even a whole day of social. It was just like an evening, and then we had 2 days of interviews. So every program's different. So you're gonna just have to reach out to them and kind of see, I guess, what they're offering.
How many places did you interview, or how many programs did you interview with? And did you have a good feeling for what programs you would end up ranking?
So I did, but again, I knew what programs I really liked, and I definitely got a feel for, you know, what programs liked me, which was good on my end. But again, I was at externships. You know, I went to 5 or 6 externships, so it's a little different. I know this year for you guys. I forget. Can you tell me what else the question was?
Yes, hold on. I scrolled down. So now I have to go and find it again. It was, wait, this is great. You guys have come through with so many questions that I have to continue scrolling. So bear with me a little bit here. Now I can't find it. Hold on.
Oh, also, I kind of remember it. So how many did I choose? So I think there's like a happy medium. I don't think you want to do like 20 interviews. I think you're gonna, well, at least when we were doing it, because it was just like a span of like 2 or 3 days, like that is a lot. That's a lot of stress on yourself. You know, you need to like relax and kind of chill too. But this year, because it's however long the interview process is, it might be advantageous, especially because a lot of people have not been to a lot of programs, to do a little more than not. But my suggestion, what I did at least, is start off with like 1 or 2 interviews with programs that I definitely like, either like it was just someone that I visited, or just someone honestly that I just picked just to have like a warm-up interview with, just to kind of get that feeling and get the jitters out. Programs that I never like interviewed or I even talked to really, and then I kind of saved my programs that I really liked or really wanted to go to, towards the end, just so you're at the top of your game, there. But again, I didn't do like 20, because I think if you're saving those till the end, you're going to be so burnt out if you do like multiple of them.
I couldn't agree more. So I kind of did the same, but like take into account like last year or years prior, they did like either East Coast programs first and West Coast programs, or they flipped it. So in last year they did West Coast programs first, followed by East Coast. So I actually started my first one with the place I externed at, because I externed there, and I only had like 3 West Coast interviews, and all 3 were places I externed at. So I went like head first, kind of like expecting to, like, I knew them, I was there for a month, they knew me. And then when it came to the East Coast, I did exactly what you said. I kind of scheduled the ones that I like didn't visit or hadn't had a chance to really know anyone there early on to kind of warm up. And then I saved the ones I really visited or like had a connection with, like the residents, towards the middle. And I initially scheduled, I want to say, like, if I look back, I think it was like 16, but after like I externed at 6 and I did like 3 extra, I canceled the rest. And I'll be honest, because you're so burnt out and you kind of have an idea of who you like, who likes you, and you actually like kind of get into a groove of like, you kind of have an idea of where you belong, or, and I know it sounds corny, but you kind of had a kind of an idea. So I think that by that point, like doing 16 was just too much for me. I did 10 and called it a day. So, but like this year, it might be a little different, because I know personally from a lot of you that I've spoken with, you haven't had a chance to visit places because of restrictions, or you haven't had a chance to like actually go there or like interact with anyone. So it might be advantageous to like do more, but I think it's also like a personal basis, like what you feel comfortable with. But I would highly suggest prioritizing the ones you really like have made an effort to visit or talk to someone, or you have a good relationship with, because I think it would be helpful this year, because we as programs also understand that we haven't had students. Like I know from my program, just with Pennsylvania and restrictions, we haven't had a lot of students come through just because we weren't allowed to have them. So I think on this side, the numbers play to your advantage, that we understand that. So I think that if you feel comfortable, I would take more interviews this time around, but also like know your limit. Like I would not recommend doing like 40 interviews and stressing yourself out. It's just not worth it, because your performance also will kind of come through that way, and you want to be cautious of that.
I'm trying to keep an eye on the time here. It looks like we've got about 15 minutes left, and we've got a ton of questions for you guys. So this is so great, and we're so happy that you all are submitting these questions. Dr. Baxter and Dr. Srinivas, you guys are doing awesome. And again, we continue to get feedback of how appreciative everyone is. So with that being said, quickly, should you look up answers to questions you don't know the answers to and email them back to the interviews after the interview is over? Thoughts on that?
I don't think it's a bad idea. Personally, we go through so many people that we're not going to remember every single question that someone gets wrong, but it does show your initiative if you are sending something saying, like I appreciate, like as we were talking earlier, like that thank you email or that card, it wouldn't be a bad idea to say, I looked up the one question that was really bothering me that I didn't know, and here's my answer. So I think that does show that you're interested.
I personally I think that like it's normal you might get questions wrong, but I don't personally remember like emailing them after, but I always sent like a thank you email to all my programs that I interviewed it with, because I know it's a long day for them too. So I agree, just like maybe like thank them through email, especially this year. I would definitely send a thank you email and then just be like, oh, I maybe got this wrong, because like you said, I don't think there's any way we're going to remember that one specific question you got wrong. So
It does show that they're paying attention when they remember the question they got wrong. So there you go. You guys are demonstrating that you remember. So that's awesome. So here's a good question for you guys, and I'm interested to know your answers to this one. If a program asks us where we rank them, what do we say? Is it okay to tell a program they are your top choice or in your top 5, or should we not answer?
I don't know. That's hard. It gets into that weird section, where the game starts to be played, and it's kind of annoying. But I think if you are interested in a place, which what probably has been shown, throughout your since your externship up to now, like I definitely know there's people that have been in contact with residents at my program, throughout the year, and you get a feel for that. They not only do they just ask if they can come and visit again, but just like everyday kind of talk and stuff. So I think that definitely goes a long way. For people who are, new, who don't really know the program and they had a really good interview, I think it wouldn't be a bad idea to like the thank you email or, whatever. I think if you genuinely do like that program, I don't think it would be a bad idea to say, I really enjoyed our interview. I really feel like I could be a good fit at that program. I am really interested in your program if something along those lines. I know, you think about, do I say that to every single program that you talk to? I mean, you can, but again, it's hard if you're saying that to every single program, because then just in general, it's hard for the programs to say, like, is this person being genuine, or are they just saying that because it's 2020 and, they're saying that to every single program because they're trying to, capture as much as you can. And that's why it's a disadvantage, I know, for a lot of you guys this year, because you just weren't able to really go into a lot of externships, and I feel for you.
I think it's like a catch-22. Like I think that it's like the gray area, like of playing a game, but at the same time, I think that be true to yourself and also give your chance to go through all the interviews. And then while you're in the interview, if someone asks you, I would just be honest with them if you visited them and just be like, it's kind of weird because I felt like I was expecting people to ask me during interviews, but all of them were like very professional. No one asked me like, where are you going to rank us or anything. But I think that I would give yourself time after to kind of like process it, because while you're going through it, you're going through so much. So every program could look great. So I would say like really sit back and like make sure you're saying the right things. But if it's a program you genuinely do like and you feel like you belong there, like you mentioned, I'm sure you were already showing your effort by like reaching out to the residents or making them aware that you are interested. So if you didn't get a chance to extern, or like you haven't had a chance to visit, but you genuinely feel like that, in that thank you email, like you mentioned, I would just mention, I think that I really enjoyed your program, like interviewing with you guys, I felt like so and so, and give them an example. And I think that would go a long way this year. But it's very hard to kind of say, because I personally never got asked, where are you going to rank us? And even though like people were kind of building me up to like kind of expect it, no one asked me that. So I kind of just took time after interviews to really process what worked for me. So I think that I would just go through all your interviews, but if you really feel like this is the program for you, I don't think it's going to hurt you if you express that to them.
I honestly, I don't even think it's like legal to like say that to people, like asking them if they're gonna rank you. That's really awkward too, I think, and for a lot of reasons. But no, I think that say, I really enjoyed your programs, I want to rank you highly. I think that's very appropriate. But I don't think you're gonna say like, yeah, you're number 3 on my list. Like that's weird.
Exactly.
So just so you guys know, we're at APMA now, we're working to put together an infographic that sort of presents the residency match process and the ranking process a little bit. And it's been a bit of a journey for me as I try to figure out how this all works. And I think there's a couple things, and I've worked with our Director of Clinical Affairs, Dr. Diane Tower, who has obviously gone through the residency match process on both ends of the spectrum. So, you know, I think there's a couple things to kind of keep in mind regarding ranking. You know, rank your residency programs in the order of where you want to go, not in the order you think the programs are ranking you, right? That's probably
100%.
most
100%.
important. If you don't want to go to a program, don't rank that program, because if you rank them and then they rank you, you could end up there, and then that's not a win for anyone. So, you know, try to really kind of remove the quote unquote game element from the match process a little bit, because I certainly haven't lived it. I'm not a podiatrist, but it really kind of sounds like a game nobody can win, and it doesn't sound fun. So, you know, just remember, programs are going to rank their top choices for residency, period. Your numerical ranking of that program doesn't have to match the program's ranking of you in order for you to match. So really, you know, just kind of look at it as, if a program has 3 slots, then they have all top choices for those 3 slots. So just don't try to guess. I think that's probably the best thing to kind of keep in mind. So I'll get off my soapbox. You guys can stay tuned. We'll hopefully have that infographic ready for you soon, and that'll help lend a little more insight.
Yeah, completely agree. That's why I said, like, wait till after you're interviewing everything and kind of like think about like where you would want to go, because you don't want to rush into saying something that you might not feel just because you have to play a game or answer. But like, I don't think no one's allowed to ask you. So take some time after your interviews just to kind of write out like what you might be looking for in a program, what fits your needs. And I think for me, I had to see it on paper, so I kind of wrote down like location, like close to family, or like I talked about like, do they get to get hands-on clinical experience, or like, are they more clinic heavy or surgery heavy? Are they academic? Things that I felt was important to me to grow. So I think it could vary from person to person. So I would just make a little list and then do a little ranking system after your interviews. Be like, this is how I felt with this program. And then kind of be like, would I be happy going here? Just a way to like kind of formulate what works best for you. Like I said, everyone differs, but for me, I had to like sit down and really evaluate each program, because I didn't want to rush into thinking a program was number one while I was just going through the process, because you have a lot of like jitters going through it. So you might think a program's great, but when you sit down, like you have to pick a best choice for you, and a lot of factors play into that.
So is there a scoring system used to evaluate and compare students during interviews? So essentially, is getting a question wrong going to count against you?
My program, it doesn't. That's not how we do it. We kind of just go off of, you know, overall how the interview went in general. If we know you, if you try to reach out, if you try to visit, all that kind of comes into play. So that's why I can't stress enough, you know, reaching out to those places that you really liked, because that we take that into consideration. You know, if people are keeping in touch with us, like that's definitely a big plus for our program.
And I don't really have a comment on it because this is my first year being part of the interview process, so I honestly have no input, and I don't really know typically how other programs do it. So I don't know, but I'll let you guys know next year if we do this again.
Okay, so I am going to end with my, oh, wait, hold on. We've got one more question here. For programs that you did not extern or visit, but were interested in, where did you acquire your information about that program?
I feel like every program that I looked at was like either a program that I knew someone at or I heard good things about. I honestly don't know, because I was pretty set. Like I knew for the most part like where I wanted to be location wise, and I had a couple programs in mind, you know, in that area. So I don't know. That's maybe I can switch over.
Yeah, so I did interview with places I didn't extern at or visit, but I kind of just looked up their like website and kind of like looked at their current resident class and what their like schedule is. And it's actually interesting. Social media, it has played a huge role, especially this year. A lot of the programs actually have like either like Instagram pages, or they have residents that like post stuff. So I actually personally just reached out to a couple. I know there was a program in Ohio I never visited, never externed at, but it was close to home. So I thought about just like interviewing with them. So prior to even going to Texas in December, I had just messaged them, and then I kind of asked them like, what's their day-to-day like, to even determine if I want to interview there. And then just that one interaction, they were like, yeah, please interview with us. And I also went back to their social, and I think it just plays to your advantage. A lot of things are virtual, so I think that you could find it. Podiatry is a small community, believe it or not. So I'm sure you know someone through someone. So if you don't know how to reach someone in a program, but you think someone else might, just shoot them a message and be like, hey, do you know anyone here? Because 9 times out of 10, I'm sure someone can connect you with them.
I think that was like the best thing you could end on. Just remember that it's a small community and someone knows someone. So biggest advice is, like kind of just watch what you say, not in a bad way, but word gets back to programs that, if you don't like them or not. So just remember that, like we were talking about, it's a pretty small community. But again, if you really like a program and you tell everyone, then that's good too. So
I agree.
All right, so my last question for both of you, looking back, what is one thing you all wish you had done differently during your interviews?
I think my thing was, like I mentioned, I initially registered for interviews, like so many interviews, because everyone was stressing me out that I needed more, I needed options. I think that looking back, I would have just kept it on the lower side, just because you get exhausted by the end of that. And also, like, I moved every month for externships, and even if you didn't, just the long days, you're not accustomed to it. And just studying in December all the time before your board exam, you take your boards, you go to interview, you get a little drained. So I would say that give yourself some time to kind of like be gentle with yourself, and you don't have, like, more does not mean that you're going to better your chance. Just be confident in yourself. And I think the places you have gone or you've talked to, I think that should be fine. I remember one of the students reached out to me and said they only got 2 interviews so far and they were worried. And I said, are those places you externed at? They said yes. And then they said, one of them is my top choice. I'm like, that's all you need. You only need one program. So I think that more interviews, more numbers does not mean you're going to have more options, or per se even like more like chances. I think that you will end up where you're meant to be. So just relax and just try to go with what you're comfortable with, and don't stress yourself into doing more.
yeah, I agree completely. I think the biggest thing is, at least, and it's hard again because it's virtual, but my biggest thing I think would be to take some time for yourself. When I was in Texas, like it's super stressful. I mean, interviews are a stressful time on top of boards and everything else. So like I know I took, I did my interviews or whatever. I tried to space mine pretty close together. So like when they were done for the day, like I was done for the day, and I had time to like go to a cool restaurant to go check out. Or I know I drove a while to Waco, Texas, just to go see Chip and Joanna's thing. So like I did something just to kind of take your mind off of that, because you need to de-stress somehow. And that's what I did. For you guys, I would say enjoy your weekend if you need to for like a day. You need to find that balance, because if you're just all studying all the time or always preparing, like you're going to be burnt out, and then questions that you would know in a normal situation you won't, because of exhaustion. So
Guys, thank you so much. Here, I will reappear on the screen momentarily. There we go. That's all the time we have for this evening. I want to thank everyone for their phenomenal questions. We have questions that we didn't even get to, so I apologize for that. But Dr. Baxter, Dr. Srinivas, thank you so much for taking the time to join us and sharing all of your experience and your insight. It's invaluable. And, I mean, it's such a bizarre time, right? So we're all grateful for any sort of guidance we can have as we move forward. And for all the students right now, you guys, best of luck to you as you all prepare for residency interviews. We know that you guys will do great. And, I think it's important to remember, believe it or not, it doesn't seem like it, but I promise, we're here to help you. And residency programs want you to succeed. Your schools want you to succeed. So you're going to do great. And if you have any further questions, you're welcome to reach out to me at any time. I'm Tiffany at APMA. And until then, you guys stay safe, have a happy and healthy holiday season, and we'll see you again soon. Have a good evening.
Thank you.
Thank you so
Thank
much.
you.
You guys can reach out to me too. I'm sure Sindhu would say the same thing. So if you guys ever need anything, don't feel like you can't reach out to us. We both have Instagram handles. And I think
Oh,
it was
that's a good point. Do you guys want to plug your Instagram and let them know where they can find you?
yeah.
Yep,
I can
I'll
do that.
put it in the chat really quickly.
Awesome. And then you guys can, if you have additional questions, you guys can DM them, reach out, give them a follow. Perfect. That's awesome. So there's Dr. Baxter's. And just so everyone knows, we have recorded this webinar and it'll be available on the apma.org/student page as soon as I'm able to upload it and get it onto YouTube.
All right.
And there is Dr. Srinivas, Dr. Skin and Bones. Awesome. Thank you guys. Have a great evening.
Yeah.
Thank
Good luck.
Bye.